everyone, and welcome back to another episode of Making a Difference in Mental Health. I'm your host, Danielle.
And I'm your co-host, Wendy.
We're so excited today. We have a very special guest, Dr. Sangeeta Verma.
Yes.
But before we begin our interview, I want to address this T-shirt that Wendy has on.
Yes.
Wendy, take it away.
Oh, yes. So anybody who knows me knows I'm from Philly, and we love our Eagles. And our Eagles are in the Super Bowl, so this is a huge weekend for the city of brotherly love, and it's iconic and because we have two African American quarterbacks facing each other in this game on Sunday. Like, how great is this in Black History Month? So we are super, super excited. All you Bird fans out there, I'm with you, and we just hope we win.
So that's the thing. After this podcast, when we come back for our next episode, we will know
who the champ is.
Who's the champ. But Wendy, go ahead and take it away for our guest today.
Sure. So we're very excited today to have Dr. Verma here. She's our resident psychiatrist from our Frederick location office. And she is going to talk to our audience today about ADD and ADHD. These are topics that I know are near and dear to our listeners' heart. There's always many questions about what is this diagnosis? What does it mean? What kind of medication are we supposed to be taking? Are we supposed to be taking medication at all? So what are we going to do with this? And so Dr. Verma's here to just tell us everything she knows about ADD, ADHD. So welcome, Dr. Verma.
Thank you for having me. It's a wonderful conversation to have. Give people some information, I think, and child psychiatry is my passion, so I love to talk about anything related to child psych. So we are talking about ADHD and ADD, just like a brief introduction. Talking about the incidence of ADHD, at least 11% of school-age children have ADHD, so it's very common. I think that's one of the most common disorders pediatricians see. I think they're the ones that get to see the kids who are struggling in school. So they are like the first maybe professional that the children might come across when they're struggling in school. As a child psychiatrist, when we're getting kids who come in with a question generally about my kid is struggling in school, they're having trouble paying attention. Some kids might be having problems with mood or learning issues. So those are some of the questions people come in with, and that's when we start the process of assessment. So should we talk about the diagnosis first, or where should we go next with this?
Well, I think you're headed in the right direction because ADHD and ADD has become, somewhat of a buzzword. And it's a high interest point to talk about for our parents, for educators, for clinicians, for mental health professionals, for therapists and counselors. But also, can you tell us the difference between the two diagnoses? And I'll just say this too. I work with a number of parents who have questions and concerns. I also work in the school system where we're often hearing just the word or the phrase or the acronym ADD, ADHD thrown out there. But we need some clarity, even for our regular lay person listeners. Can you tell us the difference with the diagnosis?
Actually, they all fall under the same category. So when we are diagnosing attention difficulties, you can have ADHD, so attention deficit hyperactivity disorder. It can be only inattentive type, so you only have trouble paying attention. And some of the children might have the combined type, where they are hyperactive, impulsive, have trouble paying attention. So they're the ones who are kind of moving around. They have trouble focusing, but they're the ones who get all the attention, actually. They're the ones who get diagnosed earlier than the kids with ADD. And then there are other kids who might not have as much trouble focusing, but they are more like motor driven, where they're more hyperactive and impulsive. So those are the three categories. When we're assessing, I don't think it makes too much of a difference what kind of problems they have, because the treatment is pretty much the same. You might handle some of the behavioral difficulties differently, but they go through the same assessment. Medications are about the same. When we're talking about behavior management, there might be differences in that. What to do with the inattentive child is going to be very different from what you do with a hyperactive, impulsive child.
Right. So, and I think, parents don't know what to do when they suspect it. So Dr. Verma, what initial steps should parents take if they believe their child might have this diagnosis?
So, some parents who might have a family history of ADHD, attention deficit hyperactivity disorder, they might pick this up a little bit sooner than other parents who might not have anybody in the family that's been diagnosed. They might struggle, but they might not be diagnosed. So sometimes the parents kind of see the symptoms before maybe the teachers might see it in school, but oftentimes it's the teachers who notice that whatever they do, whatever system or behavior management system they use in school, the child is not able to focus or not able to sit still or is extremely disruptive. So sometimes the parents will first hear about major issues from the teachers in school. I think the expectations of having to sit still and to focus a long time and then comparing them to their peer group, the teachers are able to pick out, okay, these are the ones who are struggling, and they might bring it up in a parent teacher meeting. So that's generally how it starts.
Okay.
And some parents like jump right on it because they might have some education, knowledge, experience
Right.
about it.
Right.
And they'll say, okay, let's go to the pediatrician. Most people generally are not looking for child psychiatrists at the jump. And then a lot of pediatricians, I think most of them are really good about diagnosing and starting treatment. So that would be the first step. If you ever feel, is my child struggling in school, go to the pediatrician, talk to them. They kind of know how to sort out what is ADHD or what might be other comorbid diagnosis that we can talk about that can look like ADHD, but is not ADHD.
Right. And I think you're bringing up two good points, which actually leads us into our next question. The first point that you made is that sometimes a teacher is able to tell because of observation, having a student for 6, 7 to 8 hours a day, that's plenty of time to collect data on a child's behavior and to get to know them on a daily basis. And they are able to tell a parent, these are some things that I observe. It's definitely worth either going to your pediatrician or just seeking a little bit more of a either resources or information about challenges with attention and challenges with hyperactivity, not to freehand diagnose, but a teacher would be able to really express some concern or just observation. And then you bring up another point about the diagnosis. Once this child and parent gets into the office for a screening for a diagnosis, you're able to provide receive more information. But our question is for those children who may be observed to be and then diagnosed with ADHD and they're children of color. Can you speak to sometimes the disproportionate diagnosis when there may be other things that are going on with a child of color, but the diagnosis then is ADHD?
Or the symptoms may look like ADHD, but really it's more maybe a trauma response to something going on.
Right. So, every child that is coming with attention focus, even hyperactivity issues, not ADHD child, right? So when you're doing your assessment as a child psychiatrist, we start literally from family history. What is the family history? Is anybody in the family with ADHD, mood disorder, whatever? Then we're looking for developmental history. Sometimes kids are exposed to certain, chemicals like even nicotine and marijuana. They increase the risk of you having attention and focus issues later on. And we definitely know in utero exposure to alcohol leads to ADHD kind of symptoms. So we are doing a lot of history taking as we are going along, and race, culture, socioeconomic status all kind of play into the expression of the symptoms. As I was, reading a little bit right before, when we were doing the topic came up to do this podcast, I went to this website. It's called CHADD. And when I listened to somebody talking about the differences in diagnosis for children of color, they think they get diagnosed more. Then I said, okay, let me do my own research. Then I looked at the research that was done in like there are two big studies. I can provide the link in the end. I won't go into details about how many kids, how many schools, but
Right.
like over like 5,000 kids, different schools, different states. You look at that, and what they found was actually kids of color, African American, Hispanic, Asian, they get diagnosed less often with ADHD than kids who are Caucasian. So there, I found like two different informations over there, but this is really good research. And
Mm-hmm.
why is that? So they tried to look into why is that. So they had kids who had like insurance, like Medicaid, and other kids with like private insurance. So what they found was some of it was how people look at these symptoms.
Mhm.
Uh, so some cultural pieces play into it, maybe lack of trust of physicians and the medical system. Like, I don't want to label my child. So they do get underdiagnosed, and they don't get as much treatment as children who are white. So this is Asian, Hispanic, and African American. But I think from what I read, and I cannot provide a link to that right now, I just remember reading that kids are diagnosed with more behavioral problems than ADHD. So the kids of color, the instead of looking for why is the child hyperactive or might be acting out for whatever reason, uh, children of color might get diagnosed with like having a behavior problem, whereas
Mhm.
white children might get channeled into getting diagnosed with ADHD. So that is the difference. And parental, how parents look at the symptoms and whether they accept care from the medical system or not, they found that played a part in it. But ultimately the burden of providing education and engaging families of color falls on the medical system. So it is my job, if a parent comes in and says, okay, he's struggling, no, I don't believe in ADHD, to give them as much information as I can to convince them why I believe that is it, and provide like background data, develop the trust with the family so that they can, continue the conversation, whether they decide to put their children on medications or not, but for them to understand why their children is, why the kid is struggling in school. For me, that's the most important piece. So I think there are two research studies, and I can provide a link at the end. That's what the conclusion is, that we as medical providers need to do a better job with
Right.
being able to look at cultural differences, engage families of color, I'm sorry. So
I'm really
African
happy.
American, Hispanic, Asian, all three. Go ahead.
I'm really happy you say that, Dr. Verma, because as a supervisor, clinical supervisor, I am always cautious with all my therapists about that diagnosis because I want to make sure that, as you said, we have a good history, we have a really good understanding of what's going on in school with the child, and the symptoms of oppression and racism and discrimination build up over time and can look like these symptoms where
Yes,
these kids being attentive and
absolutely.
moody and all of that. So I think we're all on the same page. We
Right.
really, it is up to us to
Yep.
really assess these kids carefully and make sure that we are giving the proper diagnosis and then
Right.
dispelling myths about once you have it, what do you do with it? So that kind of leads us into another question about treatment. So what's the best way to
So,
treat?
Wendy, if you don't mind, can I stay with the diagnosis or the etiology, as we say, the reason for some of the symptoms? I
Sure.
think that the trauma piece is also super important. Early childhood trauma can lead to mood and behavioral problems. So when I was in my training long time ago, trauma was talked about, but now I think we have more information how trauma can cause mood and behavioral problems, and what looks like ADHD might just be trauma that the child has experienced.
Exactly.
And
Right.
yeah,
Right.
so,
And remember, you bring up another point. Now my memory is tracking. We did a TFCBT. I'm sorry, training
yeah,
a few
yeah.
years ago.
You might want to tell
And
what that is.
TFCBT. See, we're all
Yeah, we all
clinicians,
can
so we
understand each other. Yes.
focused cognitive behavioral therapy training. So it was a really good training. It extended for months and months. for us to look at different cases and also understand, like you said, some children may be symptomatic or the symptoms may mirror, say, ADHD, ADD, or other behavioral symptoms, but it's actually the trauma that they've experienced and how they have learned to adapt and survive based on the trauma that they experienced. So either what we may see is either acting out, or like you said, the hyperactivity or the hypervigilance, the arousal, the challenges with trust, or the challenges with authority and making sure that I gotta fight back, but it may be a survival instinct.
Right. It's how they made it.
Yeah. And so from the outside looking in, or maybe a teacher or someone else would observe the child and say, oh, that kid has ADD, ADHD. And that's why that whole idea of the buzzword, we hear these words that are just kind of flipped around, and it's always good to have the education. So again, you bring up so many good points, and we're so glad that you're here and that you brought us back around to include the trauma piece to that.
Absolutely.
Right. So emotional dysregulation that you can see in trauma, where your emotions are dysregulated. Kids are hyperactive. They can't focus. They have maybe flashbacks, or they can't focus, they can't sit still. So they look exactly like ADHD. I believe like it's the biggest chameleon, if that's the right word to use here. You can look bipolar, you can look psychotic.
Right.
So yes. So doing a good diagnosis means starting with their life history, like starting from the beginning, really understanding where they're coming from, what their background is, so that when you are finally making a diagnosis, you're like very confident that you've ruled out other things. Like depression and anxiety, they can mimic ADHD or ADD rather, where you could be really tired, not interested, not paying attention. Anxious kids can't focus, because they're worrying constantly. So yes, a good diagnosis starts with getting the life history, what's going on in the background, and then we decide what to do next.
Okay, so with that said, we have a lot of parents who, shy away, don't want medication, want just behavioral plans. Then we have other parents who jump to the pill. We have people who always call in, it's like, my kid needs to be on a pill. They're ADHD. And then we're like, slow down. We're not really sure. We need to assess this carefully. But Dr. Verma, what types of treatment do you recommend for once a kid is really assessed and you come to that?
Right. So briefly about the assessment, there is a computer test that is also done, but what we do is basically get information from the parents and the teachers. So the child needs to have symptoms in 2 different settings to meet criteria for ADHD, like have trouble focusing, both areas, hyperactivity, impulsivity, disorganization, low frustration tolerance, procrastination, messy room, messy locker, forgetfulness. So once we've done that, then we sit and come up with a treatment plan. And most psychiatric disorders are considered to be biopsychosocial, right? So biology plays into it. The numbers for twins, monozygotic twins, is really high, like 76% of monozygotic twins, one has, the other one has. Siblings of ADHD have it, a higher rate, parents too. So there is a very strong genetic component for ADHD. And then the psychological kind of piece of it. So anxious kids tend to control themselves a little bit more. So anxious ADD kids might not look like attention deficit disorder kids, because they are so aware of the environment. They're so afraid of getting into trouble that they control themselves and work super hard. So yeah. So what was your question? I think I lost track.
Treatment-wise, courses of treatment. Because we have some parents who get a pill right away, others don't.
Biopsychosocial, sorry. And so we're always doing, let's start therapy first. So it's about psychoeducation. What is the kid facing? What does the diagnosis mean? How do we manage it at home and in school? So a lot of psychoeducation. Parent management training is very strongly indicated for attention deficit disorder. Normal parenting techniques might not work as well for kids with ADHD. They are impulsive. Short-term rewards work better than long-term rewards. And, having a lot of structure for them is very helpful as compared to kids who don't have ADHD. So we actually have a therapist right now who's doing parent management training. So that's awesome. I'm glad our clinic is able to provide that. So there's that piece where you help the parents understand what's going on. I also work on trying to get the child to understand what the symptoms mean, how they struggle. It doesn't mean they're not smart or they're problem kids. It's just how their brain is. Doesn't make them not smart. So self-disclosure here, I have ADD and my children have ADHD, and my kids, the kids I work with, they love knowing that fact, and then we can relate to that. Like, yep, I forget doing these things too, but how do you manage it? So trying to engage them in the conversation about understanding their brain. That's what I like to do, actually.
Yes.
It's not a, and like, what kind of struggles would you have? And there are some strengths and weaknesses of having trouble with focusing. You know, you can be more, people with ADD tend to think outside the box. They could be more artistic, and you know, they have more energy than maybe other people, ADHD kids especially. So that's the discussion we start out with. Meds come in the end, medications. Medications for ADHD are the most effective group of meds in the whole of psychiatry. Like, the response rate is the highest. So 70 to 80% of the kids will respond to meds. There are side effects too. A lot of side effects that need to be managed, right? You need to tell them upfront what to expect and when to stop the medicines. But medications are very powerful. But without individual therapy and family therapy, which includes parent management therapy, just meds, you don't get a very high success rate with that, because you kind of don't even understand, you know, what the symptoms mean and how to manage them, because the medications don't last the whole day. Most of the meds, actually, I shouldn't say that, but the most effective class of medicines just last during the day. So you have the early morning, you have the evening time at home. What do you do with an ADHD child? How do you make them most successful without impacting their self-esteem, without making them feel like they're a problem child?
Right. Absolutely. I think that's real key what you just said, that medication alone is not the answer to this diagnosis, that it's, you know, biopsychosocial, really being in tune, changing the style of how you parent is important, coming from, I guess, a position of more nurturing instead of punitive, really understanding
Curiosity instead of judgment.
Right. So those are all important and key ingredients to handling a child with ADD or ADHD.
Can I add one more thing that I love to do is lifestyle change, is talk about sleep, exercise, and healthy diet. So you're supporting your brain when you're getting enough sleep. Without enough sleep, your brain is not going to be functioning well. If you don't give it the nutrients it needs, you know, the vitamins and the essential nutrients, it won't be able to function. If you're already functioning like maybe at 90%, you want to get to 100% that you can with other things. And exercise is very, very, very powerful. And the older kids and adults, I would say meditation as well. But exercise is very powerful. Sunshine, exercise. Okay, that's my spiel that I gave it to everybody.
Absolutely.
I also think too that just making sure that we reinforce as a therapist with clients who do have ADHD, or parents who are, you know, constantly in the space where they are ready to learn. I always make it a point to say that there has to be the individual and family therapy in addition to your medication management. Both go hand in hand, and it can be successful if you tend to and make sure that you attend regular therapy appointments as well as your medication management. But Dr. Verma, I also want to thank you for just giving a little bit of disclosure as well, because I did hear you say that you're diagnosed with ADD and your children are diagnosed with ADHD. And so, you know, it kind of makes it a little bit more real too for our audience to know that professionals, you know, each one of us has something, and we've learned how to adapt, and we've learned how to tend to those needs. And then lastly, about the sleep, we had an episode. We just had an episode on sleep. Jonathan brought us really good information. So to hear you say it, it's just confirmation that that's something I know personally I need to work on, but it makes a lot of sense. With rest, you know, you can be at that 100%, like you said, versus that 90% and below. So
and I think parents and children getting in a routine that makes sense.
Structure for ADHD kids. Kids with depression who struggle with depression and anxiety, structure is good, but ADHD children, because they don't have the structure inside of their head, we have to provide almost like an external scaffolding outside of them. Okay, did you brush your teeth? This is the time you go to sleep. Do you have homework? Can we check? Schoology, look in the computer. So the external scaffolding that the parent provides will determine whether you're going to be successful with ADHD or not, because your brain doesn't function very well initially. As you grow older, it starts to kind of catch up, and then learning strategies in therapy, you can really overcome something that is a disadvantage in life. Let me just say that most of the kids with ADHD that are not treated, or even kids with treatment, they have more negative interactions with their parents, with teachers. Don't do this, don't do this, do this, do this, do this. So the space for positive interaction goes down. So there's a lot of kind of negative interaction that helps in their life, that impacts how they look at themselves and what kind of plans they make for themselves in the future, right? Like, if I'm always in trouble, I'm always failing, will I make plans to go to a 4-year college? Maybe not. But if you understand that, okay, you just struggle with focusing, but these are the strategies, this is the medication, and you can be successful, then it kind of changes how you view yourself, what kind of future plans you make for yourself. So I'm very passionate about this: early diagnosis, early treatment.
Right. And I think I like that you did mention when you were talking that cognition doesn't necessarily tie into it. Your IQ doesn't, having ADHD and ADD doesn't mean you have a bad IQ. And I think sometimes that's what scares a lot of parents into really facing on the diagnosis about treatment, because they mesh it all up, and it's so two different things.
Right, don't label my child, right? So it becomes like, don't label my child. You don't really have a learning disability, You are at a disadvantage, but I think there are, you're just as smart. You just have to figure out how to manage the disadvantages that you have, whether with medicine or some environmental strategies or a combination.
So we've heard strategy, we've heard structure, psychoeducation,
parent flexibility.
Are there any more encouraging words before we go? Any more encouraging words that you may have for professionals, that you may have for parents who have either challenges or who are working more to understand their child that's diagnosed with ADD or ADHD?
Having a good team is really important, right? Somebody who can understand what you're going through as a parent, as a child, and then provide you the information to help you advocate for yourself in school, right? Sometimes the teachers don't have time for you and say, why are you not doing your homework, or why do you have your head down? So helping them manage school, helping them manage, different developmental stages. If you have a good team, I think you can overcome anything. And even if you struggle a little bit, most people struggle a little bit. What difference does it make? The more you struggle, the more resilient you become. So I always have like a hopeful message. I'm an optimist at heart. There is no downside to this, is my thing. When you struggle, you just work harder. You get people to help you. You have parents, you have family, you have school. There are 504 plans that you can do in school so that the teachers recognize that maybe you have a problem, and then provide the extra support like reminders or maybe preferential seating. So that's what I would say, is like having a team around you that is, that is professional and wants to help and is caring will go a long way. That you can manage these symptoms. And, most of these symptoms, like 60% of the children with ADHD continue to struggle when they are adults in life as well. So having a good team around you is really important to provide the support to navigate the difficulties that come up. But I'm a living example of, somebody with ADD. I've understood what it means. I'm not judgmental about it. I still laugh if I forget to do certain things. It is what it is. And every day you can do a little bit better. So I think it makes me, it gives me certain strengths. Maybe I can't identify right now, but I think my ADHD might be making me who I am as a unique individual.
It may be absolutely your superpower, right? Yeah, you're super.
Yeah. And I love how you say get a good team. Wendy always says here, like, find your people, find your village, or you say find your people,
I
right?
say
You
find
find your people,
but it's the same thing.
but still, you know, it
Yeah.
takes a village to raise a child. You talk about starting quite early to build that team around that child for support so that they can be part of that 40% that's able to thrive and to able to go on and be clinicians and be doctors and lawyers and football players and you know,
Athletes, politicians, they are everywhere.
So that's super uplifting.
Yeah,
Thank you, Dr. Verma, for
You're
coming
welcome.
and sharing your knowledge about these two diagnoses that seem to be very confusing for the people that we work with. And so you brought clarity and you brought some good knowledge and strategies for parents, and we appreciate you.
Yes.
Thank you so much
You're welcome. So,
for having me and giving me the opportunity to talk about something that I love talking about anyway.
of course, we love when people can come on and just talk and you know, just speak freely. And then also you speak from a space of experience, you
And
know,
passion.
personal experience and passion. So this is the type of guest that
We love.
Right.
It just makes me go, right?
Yes,
Danielle?
yes, it does. And so we are so happy for you all to have joined us for today. My name is Danielle.
I'm Wendy.
This is Making a Difference in Mental Health. We're always striving to make a difference in mental health. We will see you next time.
Have a good week.
Bye.
Bye.